let's give you some uplift now. It is a grueling time, as we all know, for healthcare workers, but some nurses in Chicago are able to lean on each other. They're nicknamed the Old Dolls, and they've been friends for decades. And this morning, we're joined by nurses Susan O'Connell, Cindy Pascalo, Raquel Calanto, and three other women from their group at Northwestern Memorial Hospital. We should note, I see you're all wearing your masks because that's protocol, of course, at the hospital. Good morning to all of you.
Morning. Good morning.
I was just looking at some of the numbers together. You guys have a combined experience of 400 years of nursing. That is amazing. Amazing. Susan, let me start with you. First of all, just tell us where the name Old Dolls came from.
Old Dolls was a moniker given to us by one of our male nurses that we worked with. He gave it to us in our 30s. That was when he decided that we were old dolls, in our 30s. And then he would always refer to us as that when people wanted to get information, maybe question a protocol, how to do something. He would say, you better ask an old doll, check with an old doll, and it just stayed with us.
I'm looking at your picture here. The Sisterhood just oozes out of the monitor there. Cindy, a number of nurses from the original Old Dolls still work at Northwestern. Has that helped during this time?
Oh, yeah, sure does. Look at us there, man. We lean on each other. We talk to each other. We get each other's advice. Absolutely. I go to them for their expertise. I was calling them yesterday, in fact, because now we work in two different units. We're kind of spread out more over the hospital than we were when we all worked together.
Speaking of which, Raquel, let me bring you in here. Both you and Cindy chose to work on COVID-19 ICU wards. Was that a difficult decision to make?
It's very difficult, especially me. I'm taking care of my mom at home. So I have to distance myself before I could get into the house. I have to make sure that I strip out my uniform and all shoes is outside. And it's not easy, but I could see all the young girls that really have this enthusiasm to stay and fight with this. And we all have to support each other's staffing on all the ICU COVID that we opened. We opened 3, mostly like one after the other, rapidly. So we need all the help, and I decided I stay with them.
Absolutely. Now, Susan, you work on a non-COVID-19 ICU ward. Does that lessen your worry about contracting the virus? I can imagine it's still a little scary.
No, it doesn't lessen it because I believe it's everywhere. We still get patients in from nursing homes, obviously, and you just never know. We're constantly ruling people out. We constantly always follow protocol as well in just with safety, just the safety issue. You have to. And the same with Raquel, you change your shoes out, change your uniform. We just use that protocol.
You all have such phenomenal stories. Cindy, I want to mention you here. You have a family of first responders. I've read your daughter is a nurse at Northwestern, your son is a police officer, and your husband a firefighter. I can only imagine the support that you have. Talk about a family of public service.
Yeah, they're wonderful. I mean, I can't say enough. I brag all the time. People are sick of listening to me talk about them, but I feel that they're more at risk than we are here at the hospital as public servants.
Raquel, as the country begins to reopen, are you concerned about another potential spike in cases? I think we're all kind of walking on eggshells here because we just don't know what's going to happen.
Yeah, we don't know. I mean, we are all learning. And I would say if we stay disciplined and just follow the protocol that we are using now, as probably will be fine. But I know we have to continue what we're doing right now and just follow everything that they advise us to do.
Susan, let me bring you in here. The experience within the Old Dolls, I mentioned this, it spans almost 400 years. I can only imagine the value that you guys bring, frankly, to some of the younger nurses, too.
It's true. Early when this started, there was a young nurse that I oriented, and she just looked at me. She came in for the night shift. I was leaving the day shift, and she just had such fear in her eyes. And we both were masked, and I just had to give her a hug. And then she went on for the rest of her shift, and hopefully with a good vibe.
I only have about 30 seconds left, Susan, but I want to end it here. I talked earlier this year about the power of nurses. We all know nurses make the world go round. When you go into those hospitals and those settings, it's you guys who you're holding our hands. You know, sometimes you're dealing with our family. I mean, it's a lot. Is there anything you want people at home right now to know in behalf of nurses everywhere?
Keep us safe by wearing your mask and social distancing, because that's what keeps us and people out of the hospital. You have to follow that protocol. Social distance and wear your mask.
Thank you so much. Susan, Cindy, Raquel, thank you guys so much for being with us. God bless you.